Okay, I'm just wrap up our section here on generalized anxiety disorder. Substance-induced anxiety disorder. So, a couple things that about generalized anxiety disorder and substance use and the concept of substance-induced. So, first one is like with the substance-induced depressive disorder, it can be very difficult to parse out. Um, does the person have a substance use disorder primarily, and their anxiety is a side effect or byproduct of the substance use, particularly if the drug of choice is something that might be anxiety producing, which is pretty much all the any one of the substances that are identified in the DSM, in my opinion. Or do they have an anxiety disorder, like generalized anxiety disorder, for which they are self-medicating with substances and making, exacerbating their condition with it? It can be very hard to parse out. Again, like with substance-use depressive disorder, you want to see based on the extent of history you can get in the time that you have to get a detailed history. Um, have there been times, have they had significant gaps, times, periods of time, sorry, without substances or at least heavy use of substances? And were the anxiety symptoms, the generalized anxiety disorder symptoms in this case, persistent, even in the long term absence or at least significant reduction of the use of substances? Um, so uh, Now the further complication is that the use of sedative hypnotics in generalized anxiety disorder, which is accepted as a form of pharmacological treatment, they themselves can be an addictive substance, as we know from as we will learn and when we get into the different classes of drugs under substance use disorders, one of them being sedative hypnotics or benzodiazepines. So that's another complication. Um, and so if a person is overusing their prescription, that can be part of the problem or making the problem worse in terms of generalized anxiety. Or if if they're being prescribed inappropriately, too high a doses, or they're been on a drug, sedative hypnotic for years and years, when the guidance, the CDC guidance, Center for Disease Control guidance, is that that particular set of hypnotic is intended to be for short-term use only. And you may run into that a good bit because I have. So those are just a couple of things to keep in mind. And then just a couple of words about generalized anxiety disorder due to a medical condition. There are two things I would just that you might come up for you. One is sometimes people have chronic physiological conditions that they themselves create, meaning that the condition itself creates anxiety because of the particulars of it. So, for instance, people who have a gastrointestinal disorder or disease or illness of some kind, or have another condition, Crohn's disease comes to mind. Sorry, not Crohn's. Lupus comes to mind because sometimes people with lupus can have bowel control problems and being social, have to deal with a reality that they can suddenly have to go to the bathroom very very quickly, and if they're in a social situation where that's not possible, that can be very anxiety producing, understandably. So just being aware that some physiological conditions, just by their nature of the kind of symptoms they have, can be the source. The other thing is that surviving a disease for which there's maybe complete cure or at least temporary cure, and I'm thinking mostly about cancer in this instance. So people who are cancer survivors sometimes will develop anxiety, generalized anxiety disorder, that's grounded in the fear of recurrence of cancer. Even if their type of cancer and their outcome from the treatment of that cancer leaves them with less of a chance of recurrence, it can still be very consuming, and any even the mildest physiological symptom can be interpreted as a potential reoccurrence of the cancer in for that person, and cause a lot of anxiety. So almost like a survivor, post survivor traumatic response, if you will. And that's maybe particular to cancer, and in maybe other ways that's unique to cancer. Serious injury can cause generalized anxiety. Long recovery from a serious injury. Someone who's a victim of or seriously injured in a house fire, for instance, or in an automobile collision accident. These are kind of injuries, particularly if there's a long recovery involved, where a generalized anxiety disorder may develop. Fear of reoccurrence, fear of not being fully healed and getting back to their life, or even having to contend with permanent symptoms from that injury, or permanent disabilities, or pain from those injuries can also be a source of a generalized anxiety disorder. So those are just some things to think about for your consideration for substance-induced anxiety, generalized anxiety disorder, and or substance-induced anxiety disorder, and anxiety disorder related to medical condition.